Welcome, everyone, to another Inside Lyme podcast with your host, Dr. Daniel Cameron. In tonight's episode, Dr. Cameron will be discussing the case of a 3-year-old African-American child with Down syndrome, developmental delays, and disseminated Lyme disease. It's a unique case, and we're really anxious to have Dr. Cameron discuss it with us. Good evening, Dr. Cameron.
Thank you, Darlene, for leading the discussion.
So this case was first written about and described by Bax and colleagues. Can you tell us a little bit on the background of the case?
Well, these authors described a child with trisomy 21, which is commonly known as Down syndrome. And of course, they often have developmental delays. Because this child was ill, they described it in great detail. Their first thoughts. They were thinking it was some kind of illness. Maybe it was an inflammatory syndrome. Maybe it was COVID, because there were some inflammatory markers. But fortunately, they got more history that told us a lot more about this 3-year-old African-American girl.
Well, the family first lived in an area where, and the child actually played outside in an area where ticks were observed. So we know that may have been a concern.
Yeah, there's so many kids that play outside is that often it's easy to overlook that any child can get in trouble. I wrote a couple of blogs about kids that were just a few months old that were getting bit. And so this 3-year-old, I would imagine it's difficult doing a tick check. You have to always remember to do a tick check when there's so many other things a parent has to do to work with a 3-year-old who has developmental delays. But fortunately, the doctors looked at the history and took Lyme disease under consideration, because the child, the young girl, had a high fever for 9 days and a 5-day history of rashes. Now, the rashes were not quite what you often hear about or see pictures of, with a central rash with some clearing and a tick in the middle. These rashes would come and go. They said 2 to 5 centimeters. So 5 centimeters means 2 inches. And so there's something called early disseminated Lyme disease, which means that the spirochete has gotten into the bloodstream and comes out into the skin, but it often comes as multiple smallish rashes. The rashes may not be so clear-cut. They're not raised, they're flat, and so it's easy to kind of overlook the rashes. It might be easy to even think it's a virus. But in this case, they started asking a few more questions about Lyme disease. And when they talked to the family, they found the mother had noticed that the child was walking less, wasn't tolerating the leg braces or shoes, was fatigued and agitated. And I thought that was really interesting, because when you listen to a parent who says their child with a developmental disability has a problem, at least the doctors listened to the mother and took this fatigue, agitation, and changes seriously. It's also the doctors took that a note, put together the rashes, the fever, and diagnosed Lyme disease. So instead of the child getting lost in the system, that it might be a viral illness, doctor fortunately diagnosed Lyme, and with 14 days of amoxicillin, the child was better, according to the authors.
Now, they had also considered incomplete Kawasaki syndrome. Can you explain why that was considered a possible cause?
Well, certainly Kawasaki's syndrome is in the news lately because it's an inflammatory syndrome that you can get from COVID. So you start getting into these unusual illnesses, and the doctors are looking for it. And so they refer to this question called incomplete Kawasaki's, because the hand and foot was somewhat red. There were skin lesions. The fingertip had lost some of the skin, and then it's elevated C-reactive protein. So even though doctors are looking for it now that the COVID-19 is there, it reminds us that Lyme disease is so common, and Lyme disease is something that's so treatable and so easy to take care of that all doctors have the challenge of what to do with any age. And when you have a 3-year-old, you often have to depend a lot on the mother's observations and the doctor to put this story together. So it seemed like a plain old Lyme disease case in a 3-year-old, and fortunately the child got better.
Now, the authors, again, just raised a little bit of a discussion about the race of the child being an African-American and how that may or could have potentially impacted the diagnosis and treatment.
Yeah, I think there's a lot of discussion about the impact of race on people with Lyme disease. There was a study by Fix that said, by the way, more and more of the people who are coming into with Lyme disease happen to have arthritis rather than a rash. And so in that paper by Fix in the American Journal of Epidemiology said, well, maybe the doctors are not recognizing the Lyme rash in someone of color. And certainly I have lots of African Americans or Hispanics that where it's pretty easy to see a rash, but in this case, they were able to recognize that this rash was not just any rash, but this was the erythema migrans rash. So Fix reminded people to be looking for Lyme, and this author for this 3-year-old is again reminding us not to overlook these rashes despite the color.
And what are your thoughts regarding the treatment for in this case and in general? Because this was a relatively short course of antibiotics the 3-year-old received.
Well, I certainly have people that seem to be better at 14 days of treatment, and they used amoxicillin because there's a concern that doxycycline might lead to changes in the teeth or changes in the bones. Now, the CDC has done a study recently saying that for years, doctors would treat with doxycycline for 14 days for Rocky Mountain spotted fever. And they did say that for some reason, 14 days in a toddler or young child doesn't seem to affect the teeth and the bones. But still, the tradition is to do amoxicillin. I certainly have to follow my patients a lot closer because I don't trust 14 days. And my concern in 3-year-olds is how can I trust a 3-year-old, even if they don't have Downs, to give me a full history, tell me what their concentration is, their fatigue is, and a number of other issues that happen. Even the lightheadedness that some people get, it's how are you going to know if a 3-year-old is lightheaded? Mm-hmm. So I might have treated longer.
And some of those symptoms could be attributed to another co-infection as well?
Yeah, I think the reason for follow-up is that there's often incomplete treatment where someone's not better, but there's also co-infections. And the one that's best known is something called Babesia. It's a parasite. It's in the same tick. And this parasite requires a totally different treatment. So I always find a follow-up visit's important. So even though the authors said that the child was doing well, in practice, I have children and adults where it didn't work out so well. So I don't like to abbreviate treatment that short, and I always do follow-up.
Have you treated many children with Down syndrome and developmental delays who have Lyme?
Well, that was an interesting twist that even though the authors were discussing Lyme and someone with color, I've had people with who have various developmental disabilities that have come in with Lyme. So I've had autistic kids, Asperger kids, and other kids, including one with Downs. And so I think that it's challenging to diagnose Lyme as it is. In this case, the authors did a beautiful job of taking on the challenges of how to diagnose Lyme disease in a 3-year-old. It also reminds us of the challenge of, let's say, if the rashes weren't apparent or they didn't appreciate the fatigue, the irritability, how challenging it would be for a 3-year-old. And of course, the worry of every parent is that if their child doesn't get diagnosed with Lyme disease, is that it would get confusing as they get older as what's autism, what's developmental disability, and what is ADHD and those kind of issues. And so there's always the question with Lyme is how to make sure that's not a factor in a child's development.
Well, thank you so much for speaking a little bit about this case. That we should say that the study is entitled "A Case of Disseminated Lyme Disease in a Child with Skin of Color," and it was published recently in Pediatric Dermatology. So thank you again, Dr. Cameron. It's a very interesting case.
Thank you, Darlene.